My name's Andy Gillen. I'm an Associate Practice Educator here at Queen Alexandra Hospital in Portsmouth. I've worked within MOPRS for nearly 30 years now. I had a short break where I went to work in orthopaedics, but MOPRS is such a nice family that I returned to it about 5 months ago. My role, I help support all bands 1 to 4 in their essential skills training, but also I signpost them in their career pathway. So we've got support workers that have been able to go through and do their nurse training, or do different pathways. Like myself, I've gone from being a hands-on support worker on the ward to now I'm more in an education role. I really love Portsmouth Hospitals because Portsmouth is my home city, and to see people develop from coming in the front door as a brand new support worker, and many that I've seen over the years have actually now gone on to be ward managers and even higher in the whole system. The difference you can make at every level is really, really good, and that's why I love working.
Hello, I'm Babs Rickman. I'm a staff nurse and I work in the Stroke Services in MOPRS. I've worked there for nearly 5 years now, and I joined the team straight after I graduated as a newly qualified staff nurse. My job role is really quite diverse, which is typical for the stroke services. You do everything from sort of assessing patients in the emergency department, discharge services, end-of-life care. It's a really, really diverse place to work. That is actually one of the things that I love most about working in the stroke services. You get to see so many different sort of care pathways. You get to follow patients sort of either to the end of their life or to their discharge or onto rehab. And no 2 days are ever the same, and you can deal with some really, really acute care but also do a lot of rehab care, and it's just really, really satisfying work.
Hello, my name's Goodwin. I'm the ward manager on G4. I've been working in Portsmouth Hospitals and the MOPRS division for 18 years. I really enjoy working within MOPRS, and it's supported and facilitated my career very diversely. I started off here as a healthcare support worker, then I was then supported through my nursing training, and then I came straight back to work in acute MOPRS. I worked there for a couple of years. I then went over into rehab, and then I went into the community, all within Portsmouth Hospitals Trust and the diversity of MOPRS, and then I came back to working in the acute wards, and the ward now has shifted into a complex nurse-led discharge unit, which I'm incredibly proud of, and it allows all my staff to develop very, very strongly. I absolutely love my job as a manager because I have the ability to help people develop, to support them and to see them grow as individuals and help them work their way through the system and get their promotions. And I would really recommend it as a place to work.
My name's Kaylee. I'm a healthcare support worker and a student nurse. I've been here 3 years in December, and I assist the nurses every day with the patients, and I do my training alongside. The reason I love MOPRS is the diversity of patients we get and the team that I work with that help support each other, and they've helped support, MOPRS has helped me support me do my training for my nursing and progress through my career.
Hello, my name is Megan Morris. I've worked in Portsmouth Hospitals for over 30 years. I've had various roles here, from the end-of-life team, as a ward manager, discharge planning team, and at the minute I'm practice educator. So what does that mean? It means I look after all bands 1 to 9's educational needs. So we put people through degree pathways, through master's pathways, through their mentorship, and we work very closely with Health Education England. Portsmouth Hospitals is a fabulous place to work, and MOPRS have the most supportive team around. We're very close as a team and we all look after each other. In my job every day, I go around the wards, I work with the nurses. I may be teaching formally in a classroom, or I may just be working on a ward alongside a nurse and teaching with them. Each day is different. We have 9 wards to look after, and they're all quite different, from wards that look after stroke patients to head injuries to dementia patients, but they're all different in their own ways, and each and every member of staff puts 110% in, and we all look after each other, like I said.
Hello, my name is Latka Tudorova. 8 years ago I came to England. I used to work a nurse in Bulgaria, but I start my job in Queen Alexandra Hospital 4 years ago, and I'm very happy because I'm working in the hospital at the moment, and I'm working in MOPRS, and my patient, you know, they got dementia, so they need more support, and I'm so happy because we try, you know, to support them all the time, and I'm very happy as well from Portsmouth, you know, hospital team, because they support me. I wait for my PIN number, and I just, you know, wait for NMC decision to be a nurse here, and I'm very happy to work for NHS Trust Portsmouth.